Polypharmacy in Elderly. This presentation is being submitted on November 19th, 2019 for Paul Floyd's Regulatory Management course. So what is polypharmacy? Polypharmacy refers to the practice of prescribing patients 5 or more medications at the same time. Who does polypharmacy affect? So nearly half of all Americans over the age of 12 take prescription pain relievers, tranquilizers, sedatives, or stimulants. 44% of men older than 65 years take 5 or more non-prescription and/or prescription medications per week, and 57% of women older than 65 years old take 5 or more non-prescription and/or prescription medications per week. 12% of persons in this age group take 10 or more non-prescription and/or prescription medications per week. So here I have real statistics of polypharmacy. So as you can see by the graph, blue indicates 0 to 4 drugs, red indicates 5 to 6 drugs, green indicates 7 to 9 drugs, and purple indicates more than 9 drugs being prescribed. On the y-axis, we have the percentage of patients, and on the x-axis, we have the age groups that we're looking at. Clearly from the graph, as you can see, there is a drastic spike in the age groups from 60 to 79 years in age at 18.57% of patients being prescribed 9 or more medications that they're taking daily, and also in the 70 to 79 age group, it's spiked up to 15.61% of patients being prescribed. That's a huge amount. Even in between the 50 to 69 age group, there is a very high at 8.86 of 7 to 9 drugs. So polypharmacy is very prevalent in that age group of the starting at 59 to 79, where medications are being used very highly, which is the real life prevalence of polypharmacy. When can polypharmacy occur? So it can highly occur when there's a lack of communication. So when you are going to your doctor and saying that there is something wrong, or when you're going to multiple different doctors or practitioners and they don't see you on a daily basis, and maybe they don't have all the updated medications, or maybe there's multiple things going on and there could be things that could be discontinued, or they're just not keeping up on it regularly. Or we as the people assume that a supplement is healthier than consulting with your actual healthcare practitioner. So we supplement those vitamins, dietary supplements, or herbs that we think are healthier, but really it could be taking down on our body. Where does polypharmacy occur? So it occurs in outpatient and ambulatory care, which there are more healthcare providers now through technology versus actual in-person consultations services, which means that we're going through a computer screen or a TV to see our healthcare provider, and at that point they're not getting that in-person service, and so they could just be prescribing something right off the bat. Or inpatient and hospital settings, like I talked about before, not going to your routine practitioner. Where we're talking about it the most here, though, with elderly, is in the nursing home setting. So according to Seljuhun, polypharmacy in nursing homes has been an ongoing concern for the past 4 decades. In the late 1990s, the Centers for Medicare and Medicaid Services considered this such an important issue that it implemented a quality indicator measure targeting patients taking 9 or more medications, which is still an ongoing thing in today's world within long-term care. So when we see that list of medications, especially when we're on narcotics and on those controlled drugs, even the non-controlled drugs, you really want to make sure that you're doing those routine medication reviews and keeping up with what your residents are on. So, how does polypharmacy affect a person? Although aging does not change the absorption rate of most drugs, it can alter body fat and water composition. So it can have a negative decrease on blood flow, which then creates blood clots. Malnutrition. So if you are taking so much of a narcotic or drug, you may not be as hungry. You may not have that good nutrition that you need in order to stay healthy. And so that really bogs down on somebody's body and their health. And drugs toxicity. So if you are on so many drugs to the point where it is altering all of your blood flow, your nutrition, it's going to make an impact on how you as a person are doing. Additionally, should be noted that the liver metabolizes many drugs and that age-related changes can reduce hepatic blood flow and alter drug clearance. Drug elimination may be affected by age-related decreases in renal blood flow, as well as many changes caused by chronic diseases. Many drugs are bound to plasma proteins so that only the unbound or free portion is biologically active. As a result of aging, serum albumin levels decrease in adults who are experiencing malnutrition or have chronic diseases. This could lead to their higher levels of drug in the blood and cause drug toxicity. So symptoms of polypharmacy, when you need to start to kind of look into it more on what people are taking, is when somebody is tired continuously, if there's constipation, loss of appetite, when there's falls, hallucinations, depression, or confusion. So if somebody's hallucinating, you need to maybe look at what they're currently on. Are they on the right thing? Maybe they're on drugs that aren't as important that they should be on. When there's a fall, are they on a drug that maybe they don't need to be on anymore? Or if there is a decrease in their health with their nutrition, maybe they have, say they have abscessed teeth, they also have dementia, and they have an increase in confusion, they're not at their baseline anymore. Do they really need to be on those dementia medications when maybe they have a lot of other things going on? Maybe that's just one more thing that's taking down on their health. And so really having that conversation with the pharmacist, with the medical director, and your nursing team to make sure that it's in the resident's best interest. Maybe it's going to take that family meeting to talk with the family, the medical director, and see what is the best solution for this resident. Minimizing polypharmacy within the elderly. So I like this quote, but polypharmacy may be the biggest threat to seniors' health, quality of life, and longevity. So not that I like that, but I like how it states it there, because that is very true. So communication between the patient, family, provider, and pharmacist, etc., is going to be the biggest thing, like I said before. Having that meeting, making sure that we are all on the same page with the resident's health, but not only us as the providers, but also the patient, because they are the person too and have the voice, and also the family, making sure that everyone is aware and that they are all on the same page. So many patients, especially taking into consideration elderly patients, aren't going to question what pills they are taking. They have their routine in their day and they're going to get their medications. They're going to take them just like they did the day before, and so on. So they typically don't look too far into why they are feeling the way that they do, what potentially could be making them hallucinate a scenario in their head, or why they had that fall the other day. We, as the care providers, need to provide that support and look into the bigger picture for them, and ensure that they are being reviewed with their medications, and that maybe if they do have that fall or they do have that hallucination or something seems off, we take into consideration what are they currently on. So healthcare providers' responsibility with polypharmacy. Medication management, I would say, is one of the biggest, especially with communication. Use one pharmacy to fill prescriptions, so don't use multiple, because that only brings in other issues as well, and schedule regular medication reviews and checkups. So I've seen it firsthand where on your daily stand-up minutes you have when somebody starts an antibiotic or they start a new narcotic, and you're going to have that schedule or that date on your minutes so you can follow up with it and put that reminder out there for your team to remind hey, we need to check up on that, or hey, maybe so-and-so had a fall, now we're going to do a medication review, because it really does make a difference when we keep up with what our patients are doing and how much we know our residents. In conclusion, ultimately take a stand, question the side effects and the danger that come with the spread of pills being consumed each day by our residents. Polypharmacy has its advantages for patient care, but it can be a slippery slope and create unwanted negative effects and outcomes in patient care. I got that saying from the Rasmussen article that I used by Lauren Eldick, which she also found best practices for polypharmacy must be developed not only to include healthcare practitioners, pharmacists, and pharmacy technicians who interact with patients, but also include the patient as well. I think that's the biggest thing, especially this week. I've been at care providers, and I've heard it in every single scenario that I go to and listen, including the patient, and making sure that the patient knows as well. So if we see a resident or a patient who is showing signs of depression, we don't just start them on that medication. It's their care as well, and they need to be included in on it. And that's something that they're stressing huge at care providers this week, I'm seeing. And I still strongly, firmly believe by that we always talk with the resident, the patient, and ensure that they are aware of what we're doing. And if they have any recommendations too, because they're ultimately the ones that know their body. And if we listen to them, maybe the first time it's not going to work out, but that second time, maybe if we come together as a team or as a cohort and we figure it out, they're going to get better. So polypharmacy clearly is something that we want to have a good control over. And if you don't, it just shows how things can go down the slippery slope. And here are my references that I used. And that is my presentation on polypharmacy within the elderly. Thank you.